Hello, my name is Vicky Kiesel. I'm a registered genetic counsellor and I'm here to answer some of the common questions about genetic testing. What do we test for? Genetic testing is performed on a blood or saliva sample. The test examines the DNA code for the BRCA1 and 2 genes to find alterations which are likely to cause an increased risk of breast cancer. There are 3 different tests available: predictive testing, Ashkenazi Jewish mutation testing, and comprehensive BRCA1 and 2 testing. Predictive testing is available for families where the genetic mutation has already been found. This test shows whether somebody has inherited the familial mutation. If the mutation is not present, then you are not at increased risk of cancer. Ashkenazi Jewish mutation testing looks for the 3 common mutations which are responsible for 97% of BRCA mutations in Jewish families. If this test is normal, then it is possible to go on to full BRCA sequencing if the family and individual wishes. Comprehensive BRCA1 and 2 testing examines the DNA code of the BRCA1 and 2 genes in detail. If you've been diagnosed with breast or ovarian cancer, the test may explain the cause of that cancer. This test may also identify variants of unclear meaning. What's the difference between blood and saliva tests? The blood and saliva tests are different ways to obtain DNA. Once the DNA has been extracted, the genetic test is the same. How accurate is the BRCA genetic test? The BRCA genetic test is very accurate and detects more than 95% of BRCA mutations. A normal test result means it is very unlikely that you personally have a BRCA mutation. However, it is possible that you could have a mutation in a different gene. Is this the same type of test that is offered through the NHS? Yes, this test is exactly the same. Why is the test so expensive? There are millions of components in each gene, and comprehensive BRCA1 and 2 testing needs to look at every chemical. Unfortunately, this is time-consuming and expensive. What are genes? Genes are the body's instructions and determine how the body develops and is maintained. Some genes prevent cancer developing, so if there is a mutation in one of these cancer genes, then the gene doesn't work correctly and will cause an increased risk of cancer. Why would I want a genetic test? Genetic testing can help to determine your risk of breast and associated cancers. If you do have an increased risk, then there are several things we can do to lower your risks or to find cancer early should it develop. Some of these options include risk-reducing surgery, medication, and increased screening such as mammograms. Why is genetic counselling important? Genetic counselling assesses a client's family history and provides a risk assessment. The genetic counsellor will also explain exactly what the test includes and the implications of testing. How long do the results take? Your results will usually be available after approximately 8 weeks. An appointment will be made with a genetic counsellor who will explain the results and recommend appropriate cancer screening or treatment. Who should be tested? People at risk of hereditary breast and ovarian cancer may wish to consider BRCA genetic testing. Where possible, it is always more accurate to test someone in the family who has already had breast or ovarian cancer. Families with hereditary breast and ovarian cancer generally have several relatives with breast or ovarian cancer, often diagnosed at younger ages. What does this mean for my family members? If a genetic mutation is found in the family, it is possible to offer genetic testing to other relatives to help determine their risk of cancer and recommend appropriate screening. When someone has a genetic mutation, there is a 50% chance that they will pass it on to their children. How likely is it that I have a BRCA mutation? Most breast cancer occurs by chance. However, approximately 5 to 10% is hereditary and may be caused by a BRCA genetic mutation. Typically, 1 in 500 people in the general population and 1 in 40 in the Jewish population will have a BRCA mutation. However, this risk increases if you have a personal or family history of breast or ovarian cancer. A genetic counsellor can assess your family history and tell you what your personal risk is. What can I do to lower my risk of breast cancer? Maintaining a normal body weight and avoiding abdominal weight gain will lower your risk of breast cancer, as will limiting your alcohol intake and doing regular physical exercise. How do I book an appointment to discuss the test, and do I need a GP referral? Please call 0800 085 6616 to book an appointment with a genetic counsellor to discuss the test. You do not usually require a GP referral. Initially, you will be sent a family history questionnaire which will be analysed, and then an appointment will be scheduled for you with a genetic counsellor at a mutually convenient time and date. Following your consultation, if you decide to have testing, you'll be sent a genetic testing kit and asked to have your blood taken at one of our convenient blood drawing centres.